Ocular manifestations. Introduction. Ocular manifestations. Systemic diseases. Categories of systemic disease. Introduction. Categories of systemic disease. Congenital, traumatic, vascular, neoplastic, autoimmune, idiopathic, infectious, metabolic/endocrine, drugs/toxins. Eye examination. Vision. External pupils. Motility. Anterior segment exam. Introduction. Eye examination. Vision. External pupils. Relative afferent pupillary defect. Motility. Anterior segment exam. Dilated ophthalmoscopy. Visual fields. Congenital disorders. Down syndrome. Marfan syndrome. Myotonic dystrophy. Tuberous sclerosis. Neurofibromatosis. Congenital metabolic disorders. Lysosomal storage. Carbohydrate metabolism. Neurofibromatosis. NF1 cafe au lait spots. Iris leash nodules. Congenital disorders. Neurofibromatosis. NF1 cafe au lait spots. Iris leash nodules. Shaken baby syndrome. Multiple retinal hemorrhages. Traumatic disorders. Shaken baby syndrome. Multiple retinal hemorrhages. Systemic hypertension. Factors affecting retinal arterioles. Vascular disorders. Systemic hypertension. Factors affecting retinal arterioles. Severity. Duration. Malignant hypertension. Vascular disorders. Malignant hypertension. Ophthalmic circulation. Vascular disorders. Embolic disease. Sites of emboli to the ophthalmic circulation. Cholesterol embolus. Hollenhurst plaque. Left eye with superotemporal branch retinal artery occlusion. Vascular disorders. Left eye with superotemporal branch retinal artery occlusion. Cherry red spot in crow. Vascular disorders. Crow. Cherry red spot in crow. Normal fundus. Amaurosis fugax. Fleeting blindness. Vascular disorders. Amaurosis fugax. Fleeting blindness. Monocular dimming of vision. Temporary arterial obstruction. Sudden, transient, painless visual loss. Amaurosis fugax. A multidisciplinary evaluation. Vascular disorders. Amaurosis fugax. A multidisciplinary evaluation. Cardiovascular. Cerebrovascular. Ophthalmologic. Talcembal in 4 drug abuser. Vascular disorders. Talcembal in 4 drug abuser. Central retinal vein occlusion, CRVO. Vascular disorders. Central retinal vein occlusion, CRVO. Migraine, visual symptoms. Vascular disorders. Migraine, visual symptoms. Left eye. Right eye. Transient homonymous hemianopia. Scintillations. Transient obscuration of vision. Transient homonymous hemifield loss. Scintillations. Migraine, types with headache without headache. Classic common. Vascular disorders. Migraine, types. With headache. Classic. Common. Complicated. Without headache. Acephalgic. Migraine, treatment. Prevent frequent attacks. Examine for visual loss. Vascular disorders. Migraine, treatment. Prevent frequent attacks. Examine for visual loss. Consider discontinuing oral contraceptives. Blood dyscrasias with ocular manifestations. Vascular disorders. Blood dyscrasias with ocular manifestations. Hyperviscosity syndromes. Thrombocytopenia. Anemia, including sickle cell anemia. Hyperviscosity syndromes, ocular symptoms. Vascular disorders. Hyperviscosity syndromes, ocular symptoms. Amaurosis fugax. Permanent visual loss. Vascular disorders. Hyperviscosity dilated retinal veins, retinal hemorrhages, and disc edema. Vascular disorders. Leukemia. Leukemic infiltration of the optic nerve. Vascular disorders. Leukemic infiltration of the optic nerve. Sickle cell retinopathy. Vascular disorders. Sickle cell retinopathy. HBsC disease, most common form. HBSS disease. Sickle thalassemia. Retinal arterial occlusions. CFAN neovascularization. Vascular disorders. Sickle cell anemia. Retinal arterial occlusions. CFAN neovascularization. Malignant neoplasms involving the eye. Neoplastic disorders. Malignant neoplasms involving the eye. Primary ocular melanoma. Large cell lymphoma. Metastatic carcinoma. Metastatic carcinoma, most common intraocular malignancy in adults. Neoplastic disorders. Metastatic carcinoma. Most common intraocular malignancy in adults. May be asymptomatic. May produce decreased or distorted vision. Iris metastasis from lung carcinoma. Neoplastic disorders. Iris metastasis from lung carcinoma. Choroidal metastasis from breast cancer. Neoplastic disorders. Choroidal metastasis from breast cancer. Neoplastic disorders. Ophthalmologists should monitor ocular metastases at regular intervals. Autoimmune disorders, connective tissue diseases, thyroid eye disease. Myasthenia gravis, connective tissue disorders. Autoimmune disorders. Connective tissue disorders. Dry eyes are the most common manifestation. Keratoconjunctivitis sicca. Symptoms. Burning. Foreign body sensation. Photophobia. Sjogren's syndrome, dry eyes, dry mouth, connective tissue disorder. Autoimmune disorders. Sjogren's syndrome. Dry eyes. Dry mouth. Connective tissue disorder. Specific antibodies, dry eyes, treatment, artificial tears, lubricating ointment at night. Autoimmune disorders. Dry eyes, treatment. Artificial tears. Lubricating ointment at night. Punctual occlusion. Environmental modification. Topical anti-inflammatory agents. Severe tear deficiency, corneal ulceration and perforation. Autoimmune disorders. Severe tear deficiency, corneal ulceration and perforation. Ankylosing spondylitis, ocular symptoms. Autoimmune disorders. Ankylosing spondylitis, ocular symptoms. Photophobia. Redness. Decreased vision. Uveitis, refer for evaluation and treatment. Topical corticosteroids may lead to serious ocular complications. Autoimmune disorders. Topical corticosteroids may lead to serious ocular complications. Rheumatoid arthritis, ocular manifestations. Autoimmune disorders. Rheumatoid arthritis, ocular manifestations. Dry eyes. Episcleritis. Scleritis. Corneal ulcers. Uveitis. Autoimmune disorders. Episcleritis. Autoimmune disorders. Scleritis. Scleritis necrotizing scleritis. Autoimmune disorders. Scleritis necrotizing scleritis. Scleromalacia perforans. Autoimmune disorders. Scleromalacia perforans. Peripheral corneal ulceration. Autoimmune disorders. Peripheral corneal ulceration. Juvenile rheumatoid arthritis, band keratopathy. Autoimmune disorders. Juvenile rheumatoid arthritis, band keratopathy. Iritis in juvenile rheumatoid arthritis. Autoimmune disorders. Iritis in juvenile rheumatoid arthritis. Few symptoms or signs. Usually chronic. Secondary cataract and glaucoma. Refer for periodic ophthalmic screening. Systemic lupus erythematosus, ocular manifestations. Autoimmune disorders. Systemic lupus erythematosus, ocular manifestations. Dry eyes. Scleritis. Peripheral corneal ulcers. Retinopathy and optic neuropathy. Autoimmune disorders. Systemic lupus erythematosus, cotton wool spots and hypertensive retinopathy. Systemic lupus erythematosus, optic nerve involvement. Autoimmune disorders. Systemic lupus erythematosus, optic nerve involvement. Polyarteritis nodosa, ocular manifestations. Autoimmune disorders. Polyarteritis nodosa, ocular manifestations. Dry eyes. Corneal ulcers. Scleritis. Hypertensive retinopathy. Retinal vasculitis. Sarcoidosis more commonly affects African Americans and Hispanics. Autoimmune disorders. Sarcoidosis more commonly affects African Americans and Hispanics. Ocular involvement in about 25% of patients. Sarcoidosis keratic precipitates in granulomatous uveitis. Autoimmune disorders. Sarcoidosis keratic precipitates in granulomatous uveitis. Candle wax drippings in choroiditis. Autoimmune disorders. Refer patients with sarcoidosis if ocular involvement is suspected. Treatment may include corticosteroids. Giant cell arteritis, symptoms. Autoimmune disorders. Giant cell arteritis, symptoms. Jaw claudication. Headache. Scalp tenderness. Fever. Weight loss. Fatigue. Myalgias. Acute visual loss. Giant cell arteritis, ischemic optic neuropathy. Autoimmune disorders. Giant cell arteritis, ischemic optic neuropathy. Giant cell arteritis, third cranial nerve involvement. Autoimmune disorders. Giant cell arteritis, third cranial nerve involvement. Giant cell arteritis, diagnosis. Autoimmune disorders. Giant cell arteritis, diagnosis. Clinical history. Stat ESR and CRP. Temporal artery biopsy. Fluorescein angiogram. Giant cell arteritis, management. Autoimmune disorders. Giant cell arteritis, management. Begin treatment immediately with high-dose corticosteroids daily. Do not wait for results of temporal artery biopsy. Ophthalmologist, PCP, and rheumatologist manage jointly. Thyroid ophthalmopathy. Autoimmune disorders. Thyroid ophthalmopathy. Not always correlated with serum thyroid levels. Can progress after thyroid function is normal. Spectrum of thyroid ophthalmopathy. Autoimmune disorders. Spectrum of thyroid ophthalmopathy. Eyelid retraction. Exophthalmos, proptosis. Extraocular muscle dysfunction. Corneal exposure. Conjunctival erythema. Optic nerve dysfunction, thyroid ophthalmopathy, ocular involvement. Autoimmune disorders. Thyroid ophthalmopathy, ocular involvement. Widened palpebral fissure. Soft tissue involvement. Thyroid ophthalmopathy, advanced. Autoimmune disorders. Thyroid ophthalmopathy, advanced. Proptosis. Inferior rectus muscle restriction. Thyroid ophthalmopathy, severe. Autoimmune disorders. Thyroid ophthalmopathy, severe. Corneal damage. Swollen optic disc. Thyroid ophthalmopathy, computed tomography of the orbit. Autoimmune disorders. Thyroid ophthalmopathy, computed tomography of the orbit. Proptosis. Enlarged extraocular muscles. Thyroid ophthalmopathy, treatment of congestive phase. Autoimmune disorders. Thyroid ophthalmopathy, treatment of congestive phase. Tear substitutes. Corticosteroids. Orbital irradiation or surgical decompression. Thyroid ophthalmopathy, treatment of cicatricial phase. Autoimmune disorders. Thyroid ophthalmopathy, treatment of cicatricial phase. Lid surgery. Muscle surgery. Orbital surgery. Myasthenia gravis, systemic involvement. Autoimmune disorders. Myasthenia gravis, systemic involvement. Refer suspects for neurologic evaluation. Idiopathic disorders. Papilledema. Intracranial hypertension, causes. Idiopathic disorders. Intracranial hypertension, causes. Brain tumor. Meningitis. Venous sinus thrombosis. Hydrocephalus. Idiopathic intracranial hypertension, pseudotumor cerebri. Optic neuritis may be initial manifestation of MS. Idiopathic disorders. Optic neuritis may be initial manifestation of MS. Acute, painful vision loss in one or both eyes. Treat initial episode with intravenous methylprednisolone. Interferon beta-1a may be of benefit. AIDS, ocular manifestations. Infectious disorders. AIDS, ocular manifestations. Dry eye. Retinal cotton wool spots. CMV retinitis. Kaposi's sarcoma, eyelid or conjunctiva. AIDS, cotton wool patches. Infectious disorders. AIDS, cotton wool patches. AIDS, cytomegalovirus, CMV, retinitis. Infectious disorders. AIDS, cytomegalovirus, CMV, retinitis, CMV retinitis, therapy. Infectious disorders. CMV retinitis, therapy. Heart, highly active antiretroviral, therapy. 4-ganciclovir. 4-phoscarnet. Intravitreal ganciclovir. Implantable pellets of sustained-release ganciclovir into the vitreous. Infectious disorders. CD4 counts less than 100 cells/ml, opportunistic infections, e.g., CMV retinitis. Greater than 100 cells/ml, other ocular infections, e.g., syphilis, metabolic/endocrine disorders. Diabetic retinopathy. Systemic medications with significant ocular effects. Drugs/toxins. Systemic medications with significant ocular effects. Toxic retinopathy. thioridazine, chloroquine, hydroxychloroquine, tamoxifen, toxic optic neuropathy, ethambutol, isoniazid, fluoroquinolones. Ocular manifestations. Conclusion. Ocular manifestations. Systemic diseases.